husband's lab results, it was showing evidence of hyponatremia, hyperkalemia, in addition to the hypotension, tachycardia, and with his medical condition and history, I think what he's experiencing is an Addisonian crisis.
Huh?
What he's trying to say is your husband is experiencing a life-threatening emergency due to adrenal insufficiency. His lab results show a low level of sodium while having a high level of potassium. These can cause cardiac dysrhythmias and ultimately cause him to have a heart attack or worse. There are many risk factors that could have led up to this happening.
Worse? Well, he does have a lot of risk factors for the disease. He has type 1 diabetes, amyloidosis, and multiple fungal infections. But we won't go there. He was just diagnosed with HIV and also has metastatic cancer. Before all of this happened, he didn't have much of an appetite and he kept complaining of abdominal pain, nausea, diarrhea, headaches, joint pain, and progressive weakness. Not to mention, he almost passed out on the floor the other day.
Addison's disease, it's caused by an autoimmune response, and what occurs when the body's immune system assaults its own organs and tissues. With Addison's disease, the adrenal glands, they sit on top of the kidneys like a little hat, and they don't produce enough hormones, cortisol and aldosterone to be specific. And you know, it's really interesting because the hormone ACTH, that's the adrenocorticotropic hormone, that's released from your pituitary gland.
Treatment usually involves an oral corticosteroid such as hydrocortisone, prednisone, or methylprednisolone to replace the deficient cortisol. These medications are given on a schedule to mimic the normal 24-hour fluctuation of his normal cortisol levels. Then there's fludrocortisone acetate. Fucking cat.
Girl, the patient next door to me is cheating on his wife. She said that he has HIV. I don't think she has it.
Who are you?
Sorry, I was listening into your conversation. I've had Addison's disease for a long time. When I first came into the hospital, they looked through my history and saw that I had a history of tuberculosis, which is a common cause for Addison's disease worldwide. They did a physical examination. Sorry. They did a physical examination and observed bronze-colored hyperpigmentation in my palmar creases. I remember the doctor then getting lab tests and imaging to make sure it was a correct diagnosis. They would check the levels of sodium, potassium, cortisol, aldosterone, and
The nurse knows. How do you say it? Let's just say ACTH.
Yeah. Aldosterone and ACTH hormone to see if they were low in numbers. You can also have low dose ACTH stimulation test. One thing I'll never forget was getting the CT scan of my stomach to see if there was any abnormalities. To see if there was any abnormalities in my adrenal glands. They sit right up on top of each kidney, almost like little hat, but mine were huge, almost as big as the kidney itself. They definitely meant something wasn't right. So after I made some lifestyle changes and started medication therapy, and I've been doing this doing pretty good since then. Just to make sure, you call your doctor if you see any areas of your skin darkened, especially in the sun-exposed areas such as the pressure points or joint areas, or if he has any severe fatigue or confusion. And then there's a unintentional weight loss, nausea, vomiting, and diarrhea. Look out for salt cravings too. That's definitely a giveaway.
Is the TB contagious?
Not anymore.
Yes, Mrs. Hayes?
Before we go any further, can we get a private room?
No. Go.
HIV, huh? You got HIV? Dr. M, is that you?
Oh, Mrs. Hayes, right?
Yeah.
How has your husband been doing since his diagnosis?
Well, he did have to start steroid treatment because it was necessary, but as long as he doesn't go off of his prednisone abruptly, he'll be fine. I make him wear a home alert bracelet, even though he says he doesn't need it and it doesn't go with his outfit, but I think it looks fine. And I don't get offended when he puts a little bit of extra salt on his meals, even though he definitely doesn't need it. I make him go on a walk with me every day after dinner, but nothing too strenuous. And as long as he makes it to his endocrinologist's office and watches for signs and symptoms of another Addison's crisis, he'll be just fine. And you know what they say, happy wife, happy life. So we're now going to therapy about his infidelity issues. HIV, huh? You got HIV?
Girl, the patient next door to me is cheating on his wife. She said that he has HIV.
This janky ass.
Danielle, as